Hello and welcome. I have with me Mrs. Richa Devgupta. She is the Chief of Strategy for Fortis Healthcare Limited. She is an accomplished professional in the healthcare industry and is respected for the way she has taken Fortis to new heights. Richa, thank you for agreeing to be with us.
My pleasure.
Richa, healthcare is quite a thankless job. I mean, whatever you do, whatever efforts you put in, somehow people will always find a reason to complain. Over these years that you spent in healthcare, I'm sure you picked a few lessons.
Sure.
In terms of delivering customer satisfaction, customer delight, service excellence, from which all of us can learn
Sure.
as to what should we do, or more importantly, not do for achieving customer service excellence. Your thoughts, please.
Right. So I would agree and disagree with your statement, saying that it's a thankless job. It's what you're saying is right. That there are a lot of people who kind of do get unhappy with the services that you offer, but you have to find the psyche behind that. Why do they do that? Right? So as a service provider, for last 24, 25 years which I have spent in healthcare, if it was only that it is a thankless job, obviously I would have had the option to exit out, right? But then what you need to look at it is that unlike most of the hospitality sector, because some people do tend to say that healthcare delivery is also kind of hospitality sector. But what I would say is that hospitality is just one part of it. Rest is, which is very, very important part of it, is the clinical care, right? So what you need to see is when the patient comes to you, he or she, most of the time they are in distress.
Correct.
The relatives, the family who's accompanying the person is even more in distress because they don't even know as to what's happening with their patients, right? Pain is happening, what is the intensity of pain? If there is a disease, what is the prognosis? So there are a lot of what ifs in their mind as well. So once you absorb that and you know that why somebody is behaving in the manner they are behaving, then you do have the tendency to absorb and say that this is fine. Let's send them back as a happy and satisfied customer. So that's the whole premise of customer satisfaction or patient satisfaction in healthcare. You have to take it that way. Now, if you walk around in the corridors, we all feel that nurses' job is very stressed out because they are the ones who are the interface with the patient. But then, most of them, if you ask them, 90% of them, they would say that they're very happy with their profession. Reason being that 99% of people who walk out healthy and happy out of the hospital, the blessings, the goodwill, the appreciation they share with you actually makes you very, very happy.
True, and in fact, as you speak, and I was thinking that it is true that if the patient's clinical outcome is as desired, then half the battle is won there.
Okay.
Do you agree with me?
Well, now a bit of a correction here. See, we have seen that there are certain patients where you have not been able to give the desirable results. Reason being the patient has come very late to you.
True.
Sometimes it is in hospital, not necessarily that you will be able to save all the patients.
True.
So there are times when you lose lives, right? For the obvious clinical reasons. But then the main and the most important lesson or the key or the mantra is that if you are being transparent with the patient relative, if you have informed them, if you have communicated well with them, that what can they expect? See, let's look at the human psyche. When do we get upset? When our expectations are not met.
Right.
When do we get upset? When we do not know what is the outcome going to be. There is a certain level of unpredictability that makes us uncomfortable.
Right.
So if the counseling is done well, if the doctor has spent enough time and explained them that what can come out of this treatment, then even if we have some time lost patient, the patient's relative have come and told the doctors, told the staff that you did your best.
That's nice to hear.
Right? So if you have been, it is like any other relationship. You develop a professional relationship with your patients and patients' relatives also. If you have been transparent, if you have been ethical, if you have been communicative about things which is happening around and you have not kept them in dark, patient is generally happy.
And you have been at the helm of affairs when COVID,
Right.
managed COVID, which I think has been the biggest disaster that we have seen in our lives.
Absolutely.
And number of lives that we lost.
Away, yeah.
You know, but I saw there is a positive side of COVID. Is I personally feel, I don't have data at my fingertips. I think medical insurance, health insurance, in terms of penetration, has gone up because of COVID. Am I right in my?
Yes, absolutely right.
So is that impacting the business of healthcare?
Well, yes. Right.
Okay.
We have seen it. So one was that people have realized that they need to insure themselves for healthcare, not only for their life but for healthcare as well. Right. Second thing is that COVID, when it came in, contrary to people's behavior that I can't fall sick, there is something wherein you didn't really have a choice.
Yes.
Because people say that, you know, if you take care of your health, you would not have cardiac problem. If you take care of your lifestyle, some other diseases will not come. But I don't think people really had this this knowledge with them that if it is a communicable disease, if it is spread by a virus, then what havoc it can create. Now that this has happened, people do realize that they need to insure themselves. Within the within the COVID, we saw that those 2-3 years which was there, people had this awareness and they started to, those who had insurance, they increased their premium and the coverage, and those who did not have it, at least they got the basics, right? So if you look at the data, the insurance penetration increased significantly, and yes, it is increasing because see, we say that if you have to count some problems in healthcare delivery in our country, one is affordability.
True.
Right? So the moment you insure yourself, then at least you seek your healthcare much before it becomes really worse. Because you know that you're covered. You can go and check that out. You can get admitted. You can get treated. So it helps us as well because patient comes on time, and of course they have the coverage. So affordability.
They
is
feel
kind of
more confident about
yes.
it.
Yes.
A question which I cannot but ask you: COVID leadership during COVID must have taught you few lessons. Anything that you would like to share?
It did. It did. See, I think we always believe in. At least I have this innate belief that see in hospital, as I said, that there's so many patients who are coming, but we need to treat them with the philosophy that every patient is unique and every patient, every life is very, very important. Because I always see that the person who's here in the hospital is actually a very important person of a single unit which we call family.
Right.
Okay. So if there are 200, 250, 300 patients in the hospital, actually 300 families are involved at that point in time. And if we lose any life, if anything happens to any patient, it's like, you know, you're kind of taking away that person from that family. So that's how it has to be treated. So in spite of the rush which we had at the hospital, we ensured that every patient should be well attended. It wasn't that, you know, just kind of do the basics. It was like end-to-end, whatever care is required, give that. Second thing is that prioritizing, because as we always say that, you know, what is important? Is it an urgency? Is it an emergency? Okay. So those where we thought that we could save the patient, urgency needs to be given irrespective of who's coming from where and who's calling you to get the admission. We kind of prioritize that who needs to be admitted first, right? So that was the second thing. Third thing, the moment you are on the floor, you are working with a larger team, teamwork is very, very important.
True.
Right? From doctor to the nurses to the paramedic staff to the non-clinical staff, they also become equally important. Because one thing I'll tell you in COVID, one thing, while we knew that how the treatment has to go, after a few months everyone discovered that how the way of treatment has to, the protocol was set up and all of that. One very important aspect was communication with the family. Right? Because the families were not allowed for the obvious reasons. You can't meet. The person is in isolation. But at the same time, as a family, I'm very anxious as to what's happening with my relatives. Right? So setting up those channels, these people getting the information from the doctor, communicating it back to the family. So actually, even the non-clinical people in a way got completely entrenched into delivering clinical care.
Absolutely right. And that's where I think fluidity in teamwork, dynamism in teamwork is. So what are those 2 or 3 key messages that you give to your team to deliver the service standard that you envisage and anticipate?
Okay, so one thing I always say that hospital is a a complex system. It's not very simple. So if you look at it, when we look at the loop that needs to be closed, it's not A to B, B to C, C to D, and so on and so forth. It is like from A, it is to B, C, D, E, and then the further. So it's actually a very complex network, the way the service gets delivered. I always say that when we have to deliver, most of the time our tendency is that I have done my work, right? And then the ball drops. See, in production, in retail, in any other industry, if the ball drops, the losses are measurable. The losses are kind of, you can put a number to it, and it is most of the time recoverable, right? But in healthcare, that can't happen. So team has to work very seamlessly. The ball cannot drop. So I need to carry it forward till the time I know that the other person has actually caught the ball. So I'll give you an example that during COVID, right? So there were a lot of time, government had put restriction on movement and things like that. Of course, they were very supportive in terms of hospitals being exempted and some of the sectors being exempted. But then vehicles were not there. People, my staff who would commute to the hospital through buses and train and all of that. So we took a little time to organize all of that. But in the meantime, if the nurse's duty is getting over 8 in the night and the other shift has to come, these nurses cannot and would not leave till the time the next shift has actually come. In the process, some of the people actually did double duty, but so be it. They are so very dedicated and they know their responsibility that they can't leave unless otherwise. When there is somebody who has come, whom they have explained that what's the line of treatment, what's happening with the patient, give the proper handover, and then move out. So it's like an industry which works 24/7.
Globalization is impacting every business in India.
Right.
And I'm sure healthcare is no exception.
Yes.
So what are those developments globally, especially in the non-clinical sector? Now, the clinical side is a different ballgame, which you think is actually going to determine the future of healthcare business in India?
Okay. So I would say the main thing is the digital world. Right? So we all know all across the industry, different industries, IT and digital is something, digital ecosystem is something which is changing the way we have been delivering the business, right? So healthcare is no exception. Same thing is happening with healthcare, and if I say so, that virtual health is going to be the way forward.
Virtual health,
right? Because so I'll tell you now. It would never happen that it's completely, in IT space, I think saying never should be prohibited. But still, with my foresight, I would say that, see, if you need to get admitted, you need to get admitted and you have to come to the hospital. But let's see, again, taking the example of COVID, that till date, while people thought that even if telemedicine is not available, I need to see the doctor. If he has not examined me, if I have not seen him, if I haven't told him one-on-one my history, how is he going to treat me or how is he going to give me medication and all of that. But then look at this, when these restrictions came in where you can't go and hospital became a place where you would not like to walk in unless otherwise you're sick because of the fear of infection and all of that. At that point in time, the telemedicine rates actually went on to 15-20% of total physical consults, right? So when you're pushed, as they say that necessity is the mother of invention, I think exactly that got proven through the consults or telemedicine.
I think the doctors also were not so much open to teleconsultation.
Absolutely.
They were sort of forced to do.
Yes, and now, in fact, given a choice, they would like to see their follow patients on online. Which earlier they would say, "Theek ache, apni ashun, you please come over, phone hobe na." But then they are completely okay with that as well.
True. Last 2-3 questions, Richa. Fortis is a very large brand in healthcare in India, and there are few such brands.
Sure.
However, in India, if you look at the non-government healthcare system, the small nursing homes or so-called clinics with less than 100 beds are much more in number than the big players like Fortis. And that is catering perhaps to a larger and perhaps the primary point of contact for many patients.
Very true.
What would be your message to those type of clinics in terms of the critical success factors for them to have a profitable business? At the end of the day, without profit you cannot grow in business. So what are the 2 or 3 tips that you would like to give from a critical success factor point of view, which would help such institutes to thrive and prosper? Because it is also in the interest of brands like Fortis, because they will be the feeder to the larger hospitals.
I completely agree with you. And I couldn't have agreed more with you. Now, let me give an example. So, if we look at China has got around 54% of the hospitals which are actually 200, 300 bedded hospitals. Okay. Now, come back to India. India has got only 3 or 4% hospitals which are actually 100 plus bed.
That's all.
Yeah.
Well,
so I'm saying the private sector. Of course, the larger government setup we need to keep separate out of that. Now, so what would happen is, because we have to look at the larger healthcare ecosystem in India, and I'm sure you would have observed that in last 2-3 years, the number of merger, acquisitions and consolidation that you have seen, it wasn't there earlier.
Oh, it's been like too many.
Right. So, healthcare, with its virtue of getting in the process of getting an identity of a industrial sector, now what you used to see in other sectors is now happening in healthcare as well. So last 4-5 years, the consolidation that's happening, and some of the groups you would think that no, I mean it was set up by XYZ doctor, he would never give up, right? But then he's much happier today because he wants to give this up, because he knows that the system needs to be run more efficiently for me to be
earning more out of my practice.
Yes, right. Either I focus on my practice, or the profitability becomes better for me, right? Because end of the day, if you're running a business, what you care about is that profitability should increase or improve. So I am seeing a lot of willingness for these hospitals to be kind of joining hands, collaborating or associating with the larger groups, wherein they can also have the advantage of economy of scale.
That takes me to the logical question, Richa. I mean, today people are looking at job opportunities.
Sure.
In healthcare, people are aware of nurses, doctors, which are conventional job opportunities.
Sure.
What you just now mentioned, that there is this, if I may use the word loosely, certain amount of professionalism creeping into the healthcare industry. What type of job opportunities are there for young people? And B, I'm not bothered about so much educational qualifications or certifications. What are those human behavioral qualities that a person should have to succeed in a healthcare profession?
So I would say compassion and empathy.
Compassion and empathy. Can that be developed in people? Or is it
I think it can be. It can be. Because I'll tell you what, that when you're working in a system, see today, when you work in a larger organization, your organization has certain value system, right? Which may not match with your value system.
Agreed.
Okay? Now, there could be only 2 options. Either you go out of the system, or you adapt to those values and start respecting them. We have seen that, right? So every larger organization has a certain culture. And then you would see that the person who has worked there for 4 years, 5 years, 10 years, 15 years, you can actually look at them and say that, oh, are you working there? Right? So I would say in healthcare, if you continue to put your heart and soul there, right, you would develop compassion and empathy as well. And also, we have training programs built in and molded around that how you need to exhibit that.
One part is having it, other person is demonstrating and exhibiting and applying it at
Yes.
Thank you, Richa. Thank you for your time.
My pleasure.
Thank you for your insights and inputs. I'm sure those who will watch this podcast would immensely benefit from your wisdom and suggestions and inputs. Any final words that you would like to comment?
I would just say that I've spent 24 years in healthcare. Sometimes I do wonder that can we also start looking at our career graph as Western countries and a lot of other countries wherein people do take a U-turn, or people take a lateral or parallel line or get into some other industries. So that those thoughts have come to my mind as well.
So then you take the best practices of healthcare to that place?
Yeah, but then healthcare is so entrenched into me that frankly, every time, even if the offer has come my way, I actually think that no, I think I am cut out for healthcare.
And that's why you must have chosen healthcare at such a young age.
Yes.
With your master's. What was the motivation? I am going back a little bit. What inspired you to get into this type of a career?
See, frankly, I'll tell you, it was that at that point in time, without sounding too old, there weren't too many options. Right? So either you become a doctor, or you become an engineer, or you just kind of you graduate and then probably you become a teacher, you become a banker, and so on and so forth. But then I want to do something which is in professional field, which can give me my life a direction that okay, this is the field where you want to work, right? So I just stumbled upon field of rehabilitation, right? I kind of worked there, but frankly, I'll tell you that being a rehabilitation professional requires lot of patience and sacrifices and constant effort from your end, which kind of at some point would start to show you results in terms of in your own among your patients and so on and so forth. But so one, if somebody would say that one weakness that you have or one negative point that you have, I would say that I'm a bit of an impatient person. And what I realized is that anybody who's managing the system, that person has to be a speed freak, because as they say that everything is now. Right? And I thought that my energy and me being a little impatient can be channelized into that, and that's where I thought about management.
So you converted what your area of improvement into.
Yes. And then I thought that healthcare is something which excites me. So from the field of rehabilitation, probably I can get into the healthcare delivery, and I did my master's in hospital administration. And from that time till today.
Thankfully you did it, otherwise I wouldn't be having this chat with you. I wouldn't have the opportunity to sit with you and have this chat. Thank you so much, Richa, for your time, for speaking to us so frankly, so spontaneously. I'm sure those who will be watching this podcast would be enjoying it as much. Do write back to us if you want any questions to be answered by Richa directly. We will reach out to her, and through us you will get her answer. Thank you so much for watching us.
Thank you.